And welcome to week 9. This week, we're going to be talking about cancer, which is chapter 10 in your textbook. The objectives for this week are to summarize the characteristics of the cell cycle and its regulation, recognize the consequences of uncontrolled cell division, compare the appearance, structure, function, and replication of healthy cells to those that are cancerous, describe how cancer develops, and compare different diagnostic procedures for breast cancer screening. Explain the role of family history in determining cancer risk. This week's assignments include a diagnostic tool summary assignment, a family pedigree assignment, there is a cancer quiz, and of course your discussion board. The diagnostic tool summary is an assignment which allows you to identify the different procedures used to diagnose cancer. As you can see here, there are 4 listed: mammogram, MRI, ultrasound, and biopsy. To complete this assignment, use this week's PowerPoint, and you can also use internet resources to research the different diagnostic tools. For each one, identify what materials or technology is used, when should it be used, and what can it show. And for when should it be used, you can talk about routine exams, at what age should this be started, or you can talk about when something does show up, when is this tool used. Our next assignment is a family pedigree assignment. And for this assignment, it asks you to look at your family health history to determine your own risk factors. I've provided a website which creates a really cool family pedigree for you. I will show it to you in just a minute. And I understand some of you may not have access to information from blood relatives. However, I still want you to complete a family health history. Genetics are only a tiny portion of determining disease risk. Oftentimes, our shared environment, habits, and cultural traditions also play an important role in influencing our health. So please complete those, even if it's not blood relatives. So here's what you're going to do. You're going to go to the website I provided and click on Create a Family Health History. Fill in as much information as you can. You may have to call some relatives to gather information. Once you've completed entering your information, go to Pedigree Drawing, located at the top of the page. Copy your drawing and paste it onto the assignment. After completing it, answer the questions below. How many generations are included in your pedigree? What illness, diseases run in your family? And what does your family pedigree tell you about your own risk factors? So let me exit out of here really quick to show you what the website looks like. So here's the website for the family pedigree. I already entered it. Let me go back for a minute just to show you how I did that. You are going to click over here where it says Create a Family Health History. And here's where you're going to enter your information. So your own name, your sex assigned at birth, your date of birth, were you born a twin, were you adopted, your height, your weight, and your own health history. So if you've had a disease, your age of diagnosis, and then you'll have to add each one. For your family background information, you would click here if your parents are blood relatives, meaning that they are related to each other. Not to you, but to each other in any way, what race they are, and then click on Next. There's also something about Jewish history. The Ashkenazi Jews have a higher risk factor for certain diseases. Once you've filled out all your information, you would click on Next, answer it in for your family. Let me see if mine was saved so I can show you what it would look like. At the end. Maybe mine was not saved. Okay, mine must not have been saved, but it makes a nice drawing at the end for you to use to complete this assignment. So we're going to start this off with some true or false questions. So true or false? The risk of dying from cancer in the U.S. is increasing. That is actually false. In fact, the risk of dying from cancer in the U.S. Has decreased from 1975 to 2012. or false? Cancer can be spread from person to person. This is false. Cancer cannot be passed from person to person. It is not contagious like a disease. However, some viruses cause cancer, and viruses can be spread from person to person. The one that comes to mind is the HPV virus, which causes cervical cancer in women. So while you can get the virus from another person, you're not necessarily getting cancer from another person. You're just getting an increased risk. True or false? Cancer can be effectively treated. This is true. The 5 major types of treatment for cancer include surgery, radiation, chemotherapy, biologic therapies, and therapies that boost the patient's immune system. So cancer treatment has come a long way. True or false? Cancer cells can be distinguished from normal cells because of their abnormal growth. This is true. Normally, cells grow and divide to produce more cells as they are needed to keep the body healthy. But sometimes this process goes wrong. New cells can form when the body doesn't need them, and old cells do not die when they should. True or false? Cancer develops because of an abnormal gene function. This is also true. Scientists have learned that cancer is caused by changes in genes that normally control the growth and death of cells. And in addition, certain lifestyles and environmental factors can also change some normal genes into genes that allow the growth of cancer. And so here we have a picture of a healthy gene and a cancerous gene, a cancerous cell, excuse me. From looking at these photos, you can see that there are significant differences between the two images. In the next slide, we'll discover some of the specific components of cancer cells and healthy cells and how these are different. So looking at these images, you can see the cytoplasm, the nucleus, the chromatin, and the nucleolus. Look at these two images and think to yourself, how do these cells differ? First, we have a large cytoplasm in a healthy cell. You can see it here in the outer layer, and small cytoplasm in the cancer cells. In a healthy cell, you have one single nucleus. In a cancer cell, there are multiple nucleus. In a healthy cell, you have one single nucleolus. You can see it here. And in a cancer cell, there are multiple, and they are large nuclei. Lastly, in a healthy cell, the chromatin is fine. You can see over here. In a cancerous cell, the chromatin is very coarse. So these little areas in the dark blue, you can see they're coarse and not evenly distributed. So these are some of the visual aspects between a healthy and cancerous cell. When we look at the cell cycle, we have to talk a little bit about the growth phases. So gap 0, which is G0, is considered a resting phase. G1, or gap 1, is the growth phase. So it's over here, and you can see here, there's also preparation for DNA synthesis. Synthesis, the S stage over here, this is now preparing for DNA replication. Step 2 is another growth phase. It also is preparing for mitosis. And then mitosis includes nuclear division and cytokinesis. You can see here the different phases. You may recall this from your biology class in high school. And so during this, the cell has several systems for interrupting the cell cycle if something goes wrong. This is considered quality control. There are checkpoints in the G1 and G2 that look for DNA damage and try to repair it. If the damage is so severe it cannot be repaired, it will lead to a cell to self-destruct. The cell will self-destruct itself if the damage is so severe it cannot be repaired. In addition, there is a checkpoint during the mitosis phase that detects failure of spindle fibers to attach to genetic code chorus and will arrest cell in metaphase until it's corrected. So the cell must stay in the metaphase until that error is corrected. So at these checkpoints, as you can imagine, it requires the function of a complex of proteins. Now, mutations in the genes encoding some of these proteins have been associated with cancer. These checkpoint failures due to gene mutations allow the cell to continue dividing despite damage to integrity, so despite damage to its DNA. There are tumor suppressor gene mutations. So when a tumor suppressor gene is mutated, there's a loss of function resulting in the cell cycle checkpoint failure, and then this results in uncontrolled division of abnormal cells. So those two checkpoints during gap 1 and gap 2, they become ineffective and the cell continues dividing even though something is wrong with it. A way to look at that as a real-world comparison. So think about tumor suppressor genes are like the brakes of a car. When these brakes lose function, the car will move out of control. So similarly, when tumor suppressor genes lose function, the cell grows out of control. This just talks about the same thing, but you can see it here in the image. So if you have two normal genes, in this, there's one mutated gene. Now we have two mutated genes, and the tumor develops because of uncontrolled cell growth. When a proto-oncogene is mutated, now called oncogene, there is a gain of function that results in a cell cycle checkpoint failure, which also results in the uncontrolled division of abnormal cells. Again, here's a real-world comparison. So proto-oncogenes are like the gas pedal of a car. If the gas pedal is stuck in the on position, the car will continue to move regardless if that pedal is pushed or not. So similarly, when a proto-oncogene mutates into an oncogene, the cell will keep dividing even when there are no messages for it to divide. Next, we'll talk a little bit about diagnostic tests. So these are ones, and ignore the Nikki and Steve's mom, that was a case study I took out, that help the patient understand why they're sick and help make decisions about the care. Some common types of imaging include x-rays, ultrasounds, MRIs, and blood tests, and biopsies. And again, this is what your assignment will be for this week, so pay attention to the following slides. A mammogram is basically an x-ray of a breast tissue, and it can help reveal abnormalities in breast tissue that may indicate the likelihood of the presence of cancer. Just want to note that mammograms are not the ultimate diagnostic tool of cancer. It indicates the likelihood of cancer, but it's not the ultimate decision factor here. And so what this can give an idea about are the size, shape, and edges of the findings in a mammogram. There will need to be a biopsy done if something is detected in the mammogram. An MRI, or magnetic resonance imaging, uses magnetic radio waves in the computer to create hundreds of images of a part of the human body. These images are then analyzed by radiologists to look for clues that help with diagnosing of cancer. But a biopsy is the diagnostic procedure that involves removing a tissue sample from a patient and then looking at it under a microscope to detect if there are cancer cells present. This is really the only definitive way or true way to detect the presence of cancer. Often associated with the term biopsies is the term pathology. And pathology is a branch of medicine. So therefore, pathologists are doctors who study pathology. They examine patients and samples taken from their bodies and look for clues that might indicate certain types of diseases. Another diagnostic tool is an ultrasound. Often you associate the term ultrasound with a pregnant woman and looking at the fetus or embryo to see how the baby is developing. But it's also a tool to help look at abnormalities and help make informed diagnoses. So ultrasound imaging of the breast is often used to distinguish if there were a mass, whether that mass is solid-filled or fluid-filled. Generally, fluid-filled masses are not cancerous, so it can also indicate that cancer is not present. So after a diagnosis or after a procedure, you would receive a pathology report. And so when we look at what's on a pathology report, you have information about the patient over here. What was looked at? So what is the specimen received? What was the tissue? And then also the clinical history. So as you can see from this patient, she's 60. Here's her patient ID, her gender, ID and gender. The specimen received was the sentinel lymph node left axilla, the left breast tissue. And her clinical history includes having a left breast lumpectomy, which is taking a lump out of the breast. And she had left breast cancer to the left breast. And you have your gross description here. And so this is a macroscopic description of the sample, such as the size. And macroscopic means is without looking under the microscope or looking at the bigger image, not going into detail. Next, you'll see a description. And so this talks about the patient's cancer, including the stage. Generally tends to be the really important part of the pathology report. So here it's the specimen type, the size of the specimen, so what was actually taken out. Now here's tumor size, the histologic grade, the stage. This is a stage of cancer. As you know, the lower the stage, the better the treatment outcomes are. And then these are also additional test results. So oftentimes test results come at different times. So they continue to add them to the report. Another thing we're going to talk about is this idea of a breast cancer gene. So I'm sure you've heard of BRCA1 and BRCA2, and it comes from BRCA as the BR from breast and then CA from cancer. It was first described in 1990, but wasn't isolated until 1994. BRCA2 was isolated in late 1994, so it was the same year. Now, BRCA1 and BRCA2 are tumor suppressors, and they're normally expressed in cells of breast and other tissue. They play an important role in the repair of DNA strands, DNA double-strand breaks. The genes themselves are completely normal. However, when these genes mutate, these become abnormal genes. And currently, there's over 2,000 known mutations of BRCA1 and BRCA2. When we think about cancer genetics and mutations, an analogy I'm going to use here is baking a cake from a recipe book, right? So when you follow a recipe, it's like the DNA. The DNA is your body's cookbook, and DNA is read, resulting in proteins. However, just like in cookbooks, in your body, there can sometimes be mistakes. Now, some of these mistakes can just be substitutions. So let's say you're trying to make a low-fat cake. One substitution you can make is by substituting applesauce for oil. And this will not have a big effect in the cake. The cake will still come out, have good taste, have good flavor, just be lower in fat. So not a big deal in terms of a cancer mutation. However, other substitutions, so think if I use broccoli instead of using oil, this will have a huge effect on the outcome of the cake, right? It's going to fail. So similarly, DNA bases may substitute for other bases, and the result could be minor or major. There can also be too much ingredient. So maybe I had 2 extra eggs in the ingredients. Well, that's going to cause a problem. DNA bases can also be duplicated too much. Lastly, 1 or more ingredients may be missing, which can also seriously affect the cake. For example, if you don't add yeast or some sort of riser, such as baking soda or baking powder, the cake will not rise. Next, we're going to look at family history. So family history, health history is a record of diseases and health conditions that are in your family. You and your family members share genes. However, you may also have behaviors in common, right? Because you're growing up in the same environment. So more likely your diet, your lifestyle factors will be similar, your exercise habits will be similar. And so it's important when you look at your health history to remember that even though we share genes, we also share lifestyle factors. So unfortunately, you can't change your genes, but you can change your healthy or unhealthy behaviors such as smoking or not exercising or being active and poor eating habits. And I think it's even more important if you have a family history of disease. We have a lot to gain from making these lifestyle changes to reduce your chances of getting the disease. In addition, having a health history, a family health history of a disease may also preempt you to get diagnostic tests earlier. For example, if you have breast cancer that runs in your family, then you might want to start getting mammograms at a younger age compared to the recommended age of 40. It's important to continue with these screening tests, especially if there's a health risk, because as you know, the earlier you detect a problem, the better the treatment results are. So starting screening tests earlier, if there's a family health history or a family risk of that disease, is probably the most beneficial decision you can make. This concludes our PowerPoint for week 9. I hope you have a wonderful week. And as always, ask me any questions as they arise.